warning during your 10-minute presentation, and then there'll be a question and answer session after.
Right, excellent, sounds good. Thank you, and thank you all so much for the time this evening to speak with you. My name is Dan Murphy. I'm the Director of Student Orientation and Transition Programs, but here today to share an update on our work related to wellness days and to be able to answer some questions for you all around how things are going there. I, along with two colleagues, serve as the co-chairs of the university-wide programming team related to wellness days. So our focus is on creating supportive programming that takes place on each of the identified wellness days throughout the course of the spring semester. And so I'll share with you all a little update on our work. Julia, would it be okay if I share my screen?
Yes.
All right. So wellness days for the spring semester were identified as, well, first I should acknowledge that the decision to move spring break week to the start of the semester meant that we would be going through the entirety of the semester without any break from the traditional academic calendar. And wellness days were introduced as a way to approximate some of the benefits, but certainly not replace fully the benefits that would typically come along with the spring break in the middle of the semester. And so the university identified 3 days, Tuesday, February 9th, Thursday, March 11th, and Wednesday, April 7th as part of the wellness days lineup. The first of those wellness days took place last week, Tuesday, February 9th, and the next one is scheduled for Thursday, March 11th. And I just want to talk a little bit about, provide some additional insight into wellness days. I know that you all are familiar at this point as the first one has already passed to talk about kind of the direction that we're headed over the next couple of days. So what are wellness days? They are designed to be non-instructional days where students, both undergraduate and graduate, faculty and staff, are the intended and target audiences of this. And so the various communications have certainly not been as efficient or effective as they should be in making sure that we're communicating the full scope of the Wellness Days intended audience, but Wellness Days really are intended for Penn Staters as a way to approximate some of the benefits of spring break to facilitate an opportunity to pause to support health and wellness. We have, as I mentioned, a co-chair a programming team. Programming has been identified and provided as part of each of these wellness days as a way to support individuals who might be looking to support their own wellness, but might be looking for some help or assistance in that process, or maybe are interested in expanding their understanding around wellness around a variety of themes, which I'm going to talk about here in a moment. There's a noted asterisk next to non-instructional days, knowing that when this was announced that there were going to be a suite of courses and classes and research that wouldn't be able to, for a variety of reasons, either course sequencing, relationships with external entities or providers, or perhaps research needs or demands, that not every student, not every faculty member, not every instructor, not every staff member would be able to participate on the identified wellness days. And so there are a handful of programs. Dickinson School of Law, the medical school, as examples, have identified alternate wellness days, and an exception protocol was put in place early on for instructors to work through their academic leadership to request an exception from the designated days, with the expectation that alternate days would be identified. On each of these days, the university is open, and university offices should remain open and ready to support their audience. It's actually quite possible that a number of places like academic advising, counseling and psychological services, campus recreation, as just a handful of examples, might actually be busier on wellness days because students in particular are provided time to be able to tend to some of the business that they might not be able to traditionally tend to. Staff, because their schedules are different and time is allocated to staff differently than faculty, staff willing or wishing to utilize wellness days as a day off would need to take vacation time as part of that plan. Student wage and work study students, we knew from the beginning that that would be a one-on-one conversation, that they would need to work with their supervisors to work out what their preferred plan is. For some students, the need to work and to make some extra money potentially could be a commitment to wellness, but also maybe they need some additional time to attend to some built up work, or maybe do some other wellness related activity that would really be a relationship one-on-one between a student and their supervisor. Graduate students engaging in research are absolutely included in wellness days, with the understanding that not all research projects allow or afford the opportunity to step away on the designated days. And as I said before, that an alternative day or dates should be identified as part of working through what those expectations are. And that any programming offered by the institution is not required. It would be kind of the antithesis of wellness days to then turn around and require programming to take place on those days. We have a team of students, undergraduate, graduate, faculty, and staff from around the institution that are pulling together calendars and resources related to events. For each of the days, we have identified a wellness theme pairing as a way to kind of further focus our wellness activities and events throughout the course of the day. Each day will take into account emotional and social wellness. We're using a wellness model that is based out of NERSA, the professional association that our campus recreation colleagues belong to, and they've done a lot of research on wellness, and that's where these wellness dimensions originated. For February, the focus was on financial and occupational wellness. On March 11th, we have an additional focus on intellectual and spiritual wellness, and then in April, we're focusing on physical and environmental wellness, with the hopes that by April, we might be able to increase the amount of activities that we're offering outside, both because of COVID restrictions, but also because of weather. For our wellness day in February, all of the live sessions that we offered on our throughout the course of the day have been recorded and are archived at wellnessdays.psu.edu. So if you missed any of those, you're welcome to take a look. For those hosting live events, they were participation exceeded really their expectations in terms of the number of people that would attend and participate in those events. But the majority of resources that were made available were things that Penn Staters could do on their own time as part of a self-paced, self-guided experience to understand more about this particular area of wellness, financial and occupational wellness. As a preview for March, we're working on a couple of items in the programming queue. There is a team of faculty at the Penn State Abington campus who are working on a panel series throughout the course of the early part of the spring semester, focused on Asian religious responses to COVID-19. And there's going to be a panel that's going to be recorded and made available as an on-demand event as part of the March Wellness Day. But we're also working with faculty, as an example, Dr. Bill Doan on the Anxiety Project, which will be a live streamed theater experience that really focuses on a lot of the mental health and wellness focus and the anxiety associated with what we're experiencing right now. As an example of something that's coming up in April, Penn State Extension is offering a Walk Across Pennsylvania program, and that's just one of what will be a number of programs that individuals will be able to register for and participate as providing some kind of structure or accountability for engaging in a wellness activity on each of those days. There are a number of ways that people can engage. The most popular way that we expect people to engage with the Wellness Day is what we've affectionately called Do You, which is that each of us know ourselves best, and we should be encouraged to do something for ourselves that day that really support and benefit wellness for ourselves. We're also offering self-guided, self-paced activities, as I mentioned. As we return to campus and on-campus experiences, we'll begin to see local events hosted by campuses and colleges. And then also we're offering a suite of university-wide asynchronous virtual events synchronous virtual events that Penn Staters can engage in.
And you have 2 minutes.
Great, thank you, which is perfect. So in response to some of the conversations that we heard around this last Wellness Day, we are in the process of trying to communicate some ways that supervisors and instructors and faculty can better support wellness days as we move into March and April. Which would include asking managers and unit heads to consider the question, is this meeting essential? And if no, consider canceling the meeting. We need to remind instructors and faculty that recorded lectures should not replace the canceled class meetings. That defeats the purpose of the intended wellness days, as does assigning additional assignments to replace the canceled class meeting. And so we're sharing this with a number of academic leaders tomorrow morning. Additionally, it doesn't really do much to help support our wellness by creating major project or assignment deadlines that are due the next day or due the day of a wellness day or immediately following the wellness day. We heard a number of these things happening during February, and we're going to be working with academic leaders to begin to address this. And really, as I've mentioned a couple of times, if we're for whatever reason unable to honor the wellness day as originally scheduled, that an alternate date should be identified to make sure that at some point throughout the course of the semester, the opportunity to support our wellness is there and is part of the spring semester. We do have for students who are concerned about faculty or instructors who are not honoring the wellness days, that there is reporting information available on our wellnessdays.psu.edu website as a way to share those concerns with academic leadership, to have them forwarded to the appropriate academic leaders to address with their faculty. So with that said, I will open it up for questions and be able to provide answers as best I can.
Are there any questions for Dan? No, Audrey?
I think Matt raised his hand first.
Oh, sorry, I didn't see that. Matt?
Thanks. I just had a question, Dan, about maybe like how you're planning on getting student feedback from the first wellness day. Do you have a sort of like a survey or something that students could fill out to let you guys know what was, successful and not?
I'll say at the moment, we do not and have not had any conversations around a feedback mechanism, but that is certainly something that I will take back to our programming team to see if we can get something moving in short order to see how we might be able to collect insights and feedback as we move forward.
Okay, thank you.
No, Audrey?
Hi, thanks for the presentation. I was just wondering if there can be an emphasis on doing some programs on the wellness days, which doesn't require the students which doesn't involve sitting in front of a computer and Zooming, as students are Zooming continuously, rigorously for the rest of the other days. If some physical or some other kinds of connection events, some emphasis can be taken on those kinds of events and focus can be done on those kinds of things. That's one point. The other point to ask is, to reiterate is Matt's points, because from a student's perspective, I understand that the wellness.psu.edu is very well equipped in terms of providing the info, but on a mailing front, I did not see a lot of communication from the university regarding what is going on through the on the wellness days, and I was wondering if that communication can be used by the university, not just about that today is a wellness day and classes are off, but about what all students can do on that day. Yeah, that's about it, I guess.
Absolutely, and great question. We don't have great examples from February because the first wellness day took place during the remote learning period. And so our options to provide any kind of non-virtual engagement were quite limited. We're hopeful that as we continue to move forward with March and April in particular, is that we'll be able to introduce more in-person programming and options for people to get away from a screen as part of that support and that commitment to wellness. In particular, identifying and creating activities and events that individuals can do either individually by themselves or with their COVID pod that allow them to like get outside, go for a walk, do some meditation, et cetera, something that eliminates the screen piece. And it's an excellent point that you made. And unfortunately, we don't have great examples from February as we were limited in terms of what kind of programming we could provide in that environment. In terms of the communication piece, we will certainly continue to explore ways that we can share the information directing students and faculty to what the offerings related to wellness days were included through Canvas announcements, Penn State Go notifications, through Penn State Today, and a number of other lists. And we'll continue to think about ways that we can share that information as broadly as possible. If there are specific suggestions, we certainly welcome them in terms of listservs and mediums through which to communicate. But in terms of the official communication modes of the university, we did tap each of those in terms of steering Penn Staters towards the programming and opportunities that were available in February.
Thanks a lot.
Any other questions for Dan? Okay.